My name's Ginger Russell, and I'm the benefits manager for the district. And with me today, I have Kathleen Miola. She's with Ascension Insurance Benefits Solutions. Close. And today, we're here to discuss the health plan changes for 2014. We would appreciate it because we have a large group and we have a lot of information, as you can see, that we'd like to review with you today. We would appreciate it if you could hold your questions to the end. We are going to do group questions, and then, of course, we'll be available for individual questions afterwards. So if you could hang on to those, so that way we could quickly move through all the materials. Let's see here. So I'm going to have Kathleen come up. Before we move on to the health plan, we are moving to a different dental. Hopefully you all saw that in your emails because I know everyone reads them. We are moving to Delta Dental for our dental plan for next year. It is the same premiums as what you're currently paying this year, so you won't see a change in your rate if you decide to keep the same plan. Also, the plan design is exactly the same, so you have the high and the low network that you'll be able to go with for next year. And then also the providers that are in network, for the most part, are all the same. So you won't even see a difference. You will receive a new card after you enroll for Delta Dental. The few providers that are not in network that our employees are currently using, they are being recruited by Delta Dental. So hopefully they should be in network for you by January 1st. So we are going to have Kathleen come up and discuss the Affordable Care Act and health care reform with us.
Good morning, everyone. I'm glad to see everyone here today to learn about your benefits. And as Ginger mentioned, we do have quite a lot of information to cover. The first thing is just kind of providing you some information about the Affordable Care Act, and it's AKA healthcare reform, AKA Obamacare. I think we've all heard about that by now. And just basically wanted to share with you what is going to impact you, as in members of St. Lucie County School District's medical program. And one of the most important things I want you to be aware of is that the individual mandate starts January 1st, 2014. And that's a requirement, a statutory requirement, that everyone have minimum essential health coverage. And if you do not have that coverage, you are assessed a tax penalty of $95 or 1% of your income. And likely most of you would fall under the 1% of income area. So it's important to make sure that whatever decision you make as far as your benefits are concerned, that you buy a minimum essential plan, and we'll talk a little bit more about what that is, and that you have it for 1/1/14 and beyond, because these taxes, as you can see, do increase pretty substantially in future years. And that's on your sheet if you wanted to review what that looks like in 2015 and 2016. The next thing down is your out-of-pocket maximums. Within the guidelines of the federal mandate, there are limits in the amount of out-of-pocket expense that a member can have through group insurance. And the individual limit is $6,350, and the family limit is $12,700. That means that as long as you use in-network providers for benefits that are covered under your medical plan, wherever you're insured, the maximum that you're going to pay, worst case scenario, are the amounts that are indicated on your handout. In addition, the out-of-pocket maximum accumulation is going to work differently going forward, and for the school board that takes effect 1/1/14, where anything that you pay out-of-pocket for your deductibles, your co-insurance, your co-pays, and even your prescription co-pays are now going to accumulate towards that out-of-pocket maximum. So it's going to be comprehensive and accumulating for all of the out-of-pocket expenses that you incur. Removal of pre-existing conditions exclusions are also going to start for this plan 1/1/14, and that just means that regardless of whether or not you had something the matter with you from a sickness or an illness standpoint before you're effective on a plan, it's going to be covered. No exclusions for pre-existing under any circumstances. Clinical trials, there's going to be some coverage available to participants of clinical trials. Waiting periods, for those of you that are already working here at the school board, this doesn't apply to you, but for any new hires, they won't have to wait more than 90 days to get their benefits. And essential health benefits is just a listing of about 10 items that have to be covered under health plans in a certain manner. And lastly, which is the thing I want to end with, just because I believe it's the most important thing, and a lot of confusion surrounding this out there in the marketplace, is about the premium tax credits and subsidies. So the law stipulates that those that earn between 100 and 400% of the federal poverty level may be eligible for a premium tax credit or subsidy on the marketplace. Marketplace and exchange are the same things, they just changed the name. However, if you, a member, is offered minimum essential coverage through an employer plan, then you are not eligible for a subsidy or a premium tax credit. You're not eligible and your dependents are not eligible because you are offered minimum essential health coverage through an employer-sponsored plan. And we'll talk about that a little bit more later, but it's very important for you to know you're allowed to go purchase coverage on the marketplace, but there'll be no subsidies available for you. Okay? So with that, we're going to go ahead and switch gears. There is one additional handout that is from Florida Blue that was in your packet. I'm not going to spend time on this, but if you wanted more information about the Affordable Care Act, you can read this at your leisure, and it does provide some interesting information for you that you may find helpful. What we're going to do now is we're going to talk about the benefit summary for St. Lucie County School Board. These are the benefits that are available to all of the full-time employees for 1/1/14 and beyond. And there are really two plans being offered for your group. The first plan is 5771, which you can see in the column to the left. And the other two columns to the right are the same plan. It's just that the 5180 is for single coverage. And the 5181 is if you have family coverage, meaning that you're covering even one dependent. Okay? So what we're going to do first is we're going to look at the 5771 plan. This is a traditional type PPO plan. And the core benefits of the plan are your deductible being $1,500 per person, $4,500 for the family. And that means that once 3 people in your family meet the $1,500 deductible, no one has any more deductible for the rest of the year for this plan. After the deductible is met, benefits are covered at 80%, and you're responsible for 20% coinsurance. If you happen to go out of network, you're responsible for the out-of-network deductible of $4,500 per person, and benefits are then covered at 50%. And remember, when you go out of network, you are subject to possible balance billing as well. And balance billing is the difference between what the provider charges and what the Blue Cross allowable is. So it's very important to try to use the network providers as much as you can. On both of these plans, the provider network is the same network that you have today. So if your doctors or hospitals or facilities are on Blue Options and you're using them today at the in-network benefit, you're going to see that same co-pays and things that apply on the in-network basis will be the same. For out-of-pocket maximum, you can really look at this as your worst-case scenario because, as I previously mentioned, healthcare reform now requires that that out-of-pocket include anything that the member pays in-network. So $4,500 is your out-of-pocket maximum for a single, and $9,000 is the maximum out-of-pocket for family. And that means that once 2 people meet their $4,500 out-of-pocket maximum, then everything else for the rest of the year is covered at 100%. Okay? On the 5771 plan, there are co-pays for provider services. So if you look about halfway down your sheet, you can see that office services, if you go to a primary care physician, that's your PCP provider, it's a $30 co-pay for the visit. And anything that you have done within that visit falls under your copay. If you see a specialist like a OBGYN, cardiologist, that's going to be a $55 copay. And if you happen to go out of network, everything is going to be subject to that deductible of $4,500 and then payable at 50% thereafter. We're going to skip down towards the bottom to preventive care. Preventive care is covered at 100% with no cost share as long as you stay in network. So you can go in for your annual GYN visit with your pap smear, you can get a mammogram, you can go in for your routine physical with your primary care doctor, and as long as you stay in network, you have no out-of-pocket responsibility. So let's go ahead and flip to the next page, please. And under the emergency or urgent care services, if you happen to need to go to the emergency room, it's a $250 copay. That copay is waived if you are admitted to the hospital. Urgent care centers, those are your walk-in clinics, and typically they're the ones that have the extended hours with some weekend availability. You can go to one of those providers for $60 copay as long as you stay in network. And under the facility services, independent clinical lab, I think all of us are aware that Quest Diagnostics is the only in-network lab with Blue Cross Florida Blue. And as long as you go to Quest on this plan, it's 100% covered. The next one down is the independent diagnostic testing facility. Advanced imaging, those are your very expensive diagnostic tests, such as MRIs, CAT scans, PET scans. And if you need to have one of those tests, it would be a $250 copay. And for your regular diagnostic services, such as a standard x-ray, it's a $50 copay. Inpatient hospital services are subject to your deductible, and then they're going to be covered at 80%. You're responsible for 20%. And any outpatient hospital services are also subject to your deductible, and you're responsible for 20%. Let's flip to the next page, please, and we'll just talk briefly about prescription drugs. All of the plans that you're being offered are what's called a 3-tier formulary drug program, and I'm going to explain to you what that means. But for now, we're just going to go over the copays. So if you get a generic medication, it's a $10 copay. If you get a preferred brand medication, it's $30, and a non-preferred brand is $50. You still can get your 90 days at retail, or you can do the mail-away program, and it's 2 times the copay for this plan. So you can get the 90-day supply for 20 generic, 60 preferred, or 100 non-preferred. Now let's go ahead and flip back to the beginning, and we'll talk about the 5180, 5181. As it mentions, this is one plan, and it is HSA compatible. If you are a single person and enroll in this plan, you will have a $1,500 in-network deductible, and that deductible applies to all services with the exception of one. The one service that does not apply to your deductible is preventive care. So if you go in for a routine physical, a routine colonoscopy, and all of those other routine services that I mentioned before, it's covered at 100% in-network with no out-of-pocket responsibility. Okay? If you go in for any other reason, sickness, illness, accident, whatever the case happens to be, before this plan will pay a benefit, you're responsible for the $1,500 deductible. If you're a family, and remember family is employee plus one or more, you have a $3,000 deductible. And the deductible works a little differently on this plan. So remember on the 5771 plan, the maximum one person would have to meet is $1,500. Well, on the HSA compatible plans, it's an aggregate deductible. So the maximum, technically speaking, that one person could meet could be all the way up to that $3,000. So everything accumulates towards that family deductible, and once the family satisfies $3,000, then the plan covers 90% and you're responsible for 10%. So let's go over a couple of examples. If you go into the office for a primary care visit when you have the flu, and the doctor may charge $120, and Blue Cross gets a discount on what the doctor charges, and maybe the allowed amount becomes $80. You would have to pay that $80, and it would apply towards your deductible. Same thing with your inpatient and outpatient hospital services. Whatever that discounted amount is through Blue Cross, you're responsible to pay until the deductible is satisfied, and once it is, you will go ahead and get a 90% benefit with a 10% out-of-pocket coinsurance responsibility. Okay? So let's talk about prescriptions, because prescriptions on an HSA-compatible plan also apply to your deductible. So the copays that are indicated on your benefit summary only apply after your deductible is met. And there is a note there that says in-network plan deductible applies. So once you satisfy the $1,500 single deductible or the $3,000 family deductible, that's when you'll start seeing copays for your prescriptions. But until that deductible is satisfied, you will have to pay the full discounted cost of those medications. Yes, I'm going to talk about that. Yep. Now let's go ahead and talk about a little bit about the prescription drug coverage and what the heck is that preferred, non-preferred category. So obviously, you're going to want to try to use generic drugs as much as you can, because that's going to give you the very best benefit at the lowest cost to you. But for there's some of us that take a drug where there's not a generic available, or maybe you don't have a good reaction to the generic drug and you really do need to have the brand medication. Well, brands are classified into two categories. A preferred brand drug is going to be noted on the formulary as a drug tier 2. And if you find your drug tier 2, you know you're going to get that middle copay. If your drug is listed as a drug tier 3 on the formulary, it's considered non-preferred brand, and the highest copay would apply. And in order to get a copy of the formulary listing, what you would do is go to the Blue Cross website, which is bcbsfl, like Blue Cross Blue Shield of Florida.com. You're going to click on the member link, and on the bottom of the page, you're going to see a little icon that says prescriptions with a prescription bottle. You click on that, and you're going to look at the group medication guide, and it's going to have the list of every single medication that's out there for purchasing. And it'll have a little icon next to it with a 2 or a 3, and that'll identify what copay tier that drug falls under. It is important to mention that every therapeutic class of medication is represented on the preferred listing. So let's say you're on high blood pressure medication or high cholesterol medication, and your drug happens to fall in that tier 3, you have the opportunity to go to your doctor with that medication guide and ask if there's anything else that you can take that is safe for your condition. And if your doctor is comfortable writing a different prescription for a drug that's on the tier 2 program, then you'll be able to take advantage of that preferred brand copay rate. Okay? So again, it's www.bcbsfl.com. Then you click members, then you click prescriptions, and then lastly you click on the medication guide for group coverage. Okay, now Ginger's going to come up and talk about the payroll contribution rates. We're going to talk about that in a little. Yes. Yep.
Okay, you'll see the rates here, and what you have listed is what will be deducted per pay period based on the plan that you enroll in and the dependent coverage if you choose to do so. That is not part of your packet. It was part of your emails. You will also be receiving your enrollment booklets that you receive every year. You'll receive those in the middle of next week. That'll have these rates listed as well. You will see that there's a new category that we've added this year called a dual employee and spouse, dual spouse and employee family coverage. In that group, what that means is the district is contributing the same amount of money per employee depending on, it doesn't matter if you're carrying dependents anymore, it doesn't matter what level of coverage you have anymore, it is the same amount. So what this does is if you have your spouse working for the district as well, it allows you to combine the district contribution to purchase family coverage. So you'll see a rate there that's $114.81, let's just say for the high deductible health plan, the $51.81, and that would be deducted each paycheck twice a month from both employees. Okay? And then that would allow you to purchase the family coverage as opposed to the category above of the employee and family at the higher rate. So that's a nice little benefit that may help depending on your situation. Yes? Yes. That's every check. Yes. No. 114 times 2 is $228 for family coverage. 114 per employee is $228 for your family coverage per paycheck, as opposed to $476.
Right, but you said it comes from both, so that means that
No, it's 114 each employee per paycheck. You're welcome. Now we're going to discuss the high deductible health plan also is going to have a health savings account. Kathleen is going to review the health savings account with you, and then we'll also review how that may benefit you with your enrollment in the high deductible health plan.
Okay, so remember when we were going over the benefit summary, I had indicated that the 5180 and the 81 are HSA compatible. And what that means is that when you combine a high deductible health plan and an HSA, you have a consumer-driven health plan program. So what we'll talk about first is the HSA program, but that is only available to the 5180, 81 plans. If you want to enroll in 5771, you can have the FSA, flexible spending account, that is offered to you today, but you are not entitled to an HSA. So let's go ahead and flip to our HSA handout, Health Savings Account HSA program. And I'm going to read a lot of these bullets because these are important elements that everybody needs to understand about the program. So first and foremost, an HSA is a tax-free savings account belonging to you as the member. You are opening up a bank account with a insurance company, a bank, or a designated IRS trustee, and you're able to use that account to pay for your out-of-pocket expenses that you incur, medical-related, dental-related, prescription-related, or vision-related, okay? And in order to be on an HSA, you have to be in a high-deductible health plan, and that's why the HSA is only available for the 5180-81. So the benefits of an HSA, number one, if you enroll in this program, the board is going to give you $750 of a contribution into your HSA. So they're going to give you money to help offset that deductible in 2014, and that money will be available to you on January 1st. The next benefit is that any contributions that you decide to make to your HSA come out of your paycheck on a pre-tax basis. The contributions that you make and the contribution that the board is making stays in your account and rolls over from year to year to year. So it's very different than the FSA program that you're accustomed to. So let's say, for example, the board puts in $750 and you put in $750, and you're lucky enough to not have any health expenses for the year, then that amount of money will roll over to 2015, and it'll keep rolling over, rolling over, rolling over until you decide that you want to use it. The interest and earnings on your account are also tax-free. Once your account gets to a certain threshold, it's usually $2,000, you are allowed to invest that money just like you would like a money market type program, and any gains on that would also be tax-free. And next, we've already talked about is that your qualified expenses include RX, which is prescriptions, dental and vision, as well as medical. You're also able to use your HSA funds to pay expenses for your spouse and your dependent children, even if they're not on your health plan. So maybe you take the school board single coverage 5180 plan, and your dependents have a different program, but maybe they also have a deductible. You can use your funds to pay for that deductible on that tax-free basis. The HSA funds, as I mentioned, can be invested if a certain threshold is met. And the most important thing is the HSA is portable. So it stays with you as the person, not the employee. If you decide that you want to leave the school board at some time or you're retiring, that money is yours, and it goes with you wherever you go. In order to qualify for an HSA, number one, you have to be covered under that high deductible health plan that I mentioned. You're not able to be covered under any other medical policy, and subject to IRS guidelines. It's group, major medical coverage. If you maybe have an accident or a hospital plan with AFLAC or something like that, that's okay. This is just other major medical comprehensive coverage. You are not able to be enrolled in Medicare, and you cannot be claimed as a dependent on someone else's tax returns. So as long as you meet that criteria, you're eligible for the HSA, and you can make contributions each year up to a IRS mandated maximum. And you can see single coverage, the maximum for 2014 is $3,300. Family is $6,550. And if you're 55 or older, you can contribute an additional $1,000 per year, which is called a catch-up contribution. We're going to hold questions till the end, please. Okay, thank you. This amount here includes the board contribution. So the $3,300, the board is giving you $750, and you can do the difference or something less. If we go to the next page, you can see that if you're interested in looking at a more comprehensive listing of the IRS available reimbursement eligible expenses, you can go to that website there, irs.gov, and I did provide the link so that you can find the page that you need. But if you're familiar with the FSA, it's the same list. So, for example, if you need an over-the-counter medication, you're going to need a prescription from your doctor in order to use your HSA funds. And as I mentioned, most traditionally folks use it for your deductible, your coinsurance, your copays, and your RX copays. You are allowed to use your HSA funds for non-qualified medical expenses. However, if you're under age 65 and you use it for something that's not on that list, you're going to be assessed a 20% penalty, and you're going to have to pay taxes on those funds. So try really hard if you can to only use that for qualified expenses. But when you reach age 65, you can use that for whatever you like. And if it's something that's qualified, it's tax-free. If it's non-qualified, all you would have to do is pay income taxes on the amount that you take as a non-qualified distribution. So how would you fund an HSA account? You are able to make payroll contributions, and you can do that a couple of different ways. You can decide during open enrollment if you want a certain amount of your paycheck withheld pre-tax to go into your HSA account. You can make a lump sum contribution anytime after your HSA account is open, and you are able to make an after-tax contribution to your HSA and file it on your income tax return the next year so that you reap the tax advantage. So let's talk about that for a second. Let's say during open enrollment you decide that you want $50 from your paycheck to go into your HSA account, but then something major happens and you need to be admitted to the hospital or have surgery, and you don't have enough money in your HSA account to fund those expenses that you know you're going to incur. You can instruct your employer to take out a bigger amount from your paycheck to cover the difference. So maybe the next couple times you get paid, you want them to take out $250 from your paycheck, and then you want to go back to the $50 after that. Or maybe something happens and you just need some extra money and you don't want that $50 to come out of your paycheck anymore. In the middle of the year, you can instruct the school board to stop doing your deductions and you no longer want to contribute to your HSA. So this is a benefit that is not subject to the typical open enrollment rules that you're only allowed to make changes once a year and you're locked in for the year. You have much more flexibility with the HSA. My personal example is I had a baby in April of last year, and I only had from January until the beginning of April to make sure that my $5,000 deductible was met. So I basically had my employer put my entire paycheck into my HSA account so that I could have that $5,000 ready for me when I needed to pay the hospital. And then I at least saved the taxes, if nothing else. Okay. And the last thing is on the HSA, the administrator for St. Lucie County School Board is Health Equity. Health Equity is a strategic partner of Blue Cross Blue Shield Florida Blue. And what's going to happen is when you enroll in the high deductible health plan, you're going to be issued a welcome kit. And it works like a bank account. So you're going to have to comply with the Patriot Act legislation, filling out all the paperwork to make sure that you're a U.S. citizen and so forth. And you're going to get a debit card. And anytime you have an expense that's qualified under the program, you just swipe that debit card and you're good to go. Health Equity has a very robust online portal that you're able to go to look at your claims activity. You could check your balances. Maybe you forgot your debit card at home and you needed to go to a doctor and you didn't get to pay them. You can instruct Health Equity to pay directly from your HSA account to a provider. And lastly, let's say that you had a situation like mine when you didn't have your deductible accumulated within your HSA and you decided to use your own funds to pay that instead. When you get your money built up in your HSA account, you can reimburse yourself for that expense as long as you do it within the same year that the expense was incurred. So you can direct Health Equity through their website to make a direct deposit right into your checking account, for example. Okay. And at this point, I'm going to go ahead and turn it over to Ginger.
There's just a couple of other pieces that we want to point out as far as the high deductible health plan and the health savings account. We want anyone who decides to go with the high deductible health plan, that you need to understand it's a one-time contribution. This is not something that's going to be set annually to be paid into your health savings account by the district. So as of now, it is a one-time contribution. We do suggest that if any of you are interested in this plan, if you take a look at what you may currently be enrolled in, and I'm going to use the single employee as the example. Most of our employees are enrolled in single coverage. They are not carrying dependents today, but most of our employees, about 95% of our employees, are enrolled in the Blue Options 3748, and I would say probably if you have our health plan, that's what you're in now. And if you're a single employee on the plan, you're currently paying $46.83 per paycheck for that coverage. You'll see that next year, if you go to the high deductible health plan, the rate is only $7.20 per pay period. Okay, so that's a $40 decrease in premiums. Okay. A suggestion that we have, and this is what I'm personally going to use, is I'm going to take that $40 savings and I'm going to add that into my health savings account. Because, yes, I'm going to have a $1,500 deductible. $750 of that, of course, is funded by the district this year and will be ready for me January 1, so if I need to go to the doctor, I'll be able to utilize it then. But then I'm also going to take my savings and put it into that health savings account. So if you take that $40, 24 times a year, it's $960 you can add into your health savings account. So you have more than your deductible saved by the end of the year. Okay. Your plan, that plan has a $3,000 max out of pocket for the single employee. That's exactly what you have today. So there's no difference there. That protection that you have in the event of a catastrophic event is still in place for you. So those are some things, and of course you can have more than that, as Kathleen reviewed with you, but you can place more money into that account and you won't lose it. So that will continue to be available for you in future years. You can reduce that amount as she had discussed, and it's really important that you understand, especially for my payroll friends that are here, that deduction is actually managed through the risk management department. It's not going to be managed through payroll. So if you do need to make adjustments to your health savings account, you'll want to come see us. But, you know, that can be adjusted based on whatever events may be happening to you throughout the year. But a really important piece is that, as we all know, when we go to the doctor, you get your statement either from the pharmacy or your provider. You get your explanation of benefits from Florida Blue. And it states on there that the doctor charged $300 for your visit. We all know Blue Cross does not pay $300. They have a significant discount. That's one of the benefits of being with them. So what maybe Blue Cross may only end up paying $120 for that visit. That would be your responsibility prior to your deductible being met. So you wouldn't pay that full $300 fee. It's just the allowed amount, or what the discounted amount is that Blue Cross Blue Shield pays for that benefit. And I have one final point for those of you who may be using the dual spouse option. That is something that is going to, you have to meet with an enrollment counselor together. Okay, you will not be able to meet you at your site and then your spouse at a different site. You have to come together. You have to indicate who's going to be the primary member on the plan. So there's several things you have to do together. And in order to accommodate that, you can come here to the district office at any time. The enrollment counselor at your location is able to help you with the enrollment, both of you, even if you don't work at that site. But we will be offering a Saturday, and you'll get more information on this, where we will be open on a Saturday for dual spouses only. And then we will have a few nights where we're open a little late as well to accommodate those who cannot get to a school site. But you are welcome to see an enrollment counselor at a school location as long as you're with your spouse. And you need to schedule 2 appointments together. So we do understand that dependent coverage is becoming more difficult to use here through the district. We understand that. With us today we have Deanne Pierre-Louis with Florida Healthy Kids and Kid Care. She's going to review with us very briefly how Healthy Kids may work for you or may benefit you for your children, and go through the rules. And then after that we will do a question and answer session for you.
Good morning. I am glad to be able to give you some information about the Florida Kid Care and Healthy Kids. I am the outreach coordinator for Healthy Kids of St. Lucie County, and my job is really to make sure that families in the county know that they have options when it comes to their children's health insurance. Now, the one thing that I'd like to point out is the eligibility for the families that are applying. The first thing that you need to remember is the insurance is for the uninsured. It's not for kids that already have coverage and the family just feel like, well, I'm changing, I just want to get something else, I'm applying for Florida Kid Care. If your coverage is unaffordable, they will make some concession and look at your situation and see whether or not they can accommodate you. However, if you have coverage, if you are during your open enrollment and you decide to re-enroll your child, then that will not work. Your child have to be uninsured. Now, but if your insurance, if the cost of your insurance is more than 5% of your gross income, if the cost for the child is more than 5% of your premium, then you will be able to cover the child. Just keep that in mind. I know that a lot of you will make some changes in your insurance come January 1st, and you have to process it now because it's open enrollment. As of December 1st, you will be able to apply for your child because come January, they will not have insurance if you do not re-enroll. But you cannot apply for them prior to December 1st. It has to be December 1st. Now, one of the things you have to keep in mind, there is a time period to process that application, so you want to do due diligence and make sure that not only do you apply on time, that you also submit all your information because there is some income documentation that you need to provide in order for Florida Healthy Kids, Florida Kid Care to decide whether or not you are eligible. You have to provide those information within a time frame that would allow them to process it and for your child to be covered by January 1st. So that's a good thing. If you do an application, you'll be able to upload all your documentation. You don't have to mail them, or you could also fax them. And as soon as you pay your first premium, you will know, they will let you know what that premium is, and you pay your premium, the child might be covered by January 1st. And that's what we would like to see. Now, if your child is under 19, between 1 and 19, you have an opportunity to have the full pay premium, which means if you do not meet the threshold for the premium assistance, you will be able to purchase the insurance and pay full rate. Now, you may ask yourself, what are those guidelines? What is the threshold? Now, for a family of 2, if you make between $31,000 and $47,000, I'm saying family of 2, I should have said family of 4, I'm sorry. For a family of 4, if you make between $31,000 and $47,000, you will have what we call the subsidized premium assistance, and you would be paying between $15 and $20 a month for all the kids in the household. Remember, this eligibility is based on family size and income, so that decision is not going to be made on a case-by-case basis. It's for everybody. So, but if you make over $47,000 and you are a family of 4, you will be eligible to purchase at a full rate. And the full rate is for children between 1 and 5, it's $196 a month. And for children between 5 and 19, it's going to be $142. Just remember, if you meet the guideline for the premium assistance, you pay $15 or $20 for all the kids. But if you do not meet those guidelines, you don't meet the threshold, you will still be able to purchase the insurance. And it's not subject to copay, deductible, cost sharing, or anything like that. Once you pay that $196 for the child under 5, or you pay $142 for the child between 5 and 8, that's your cost for the month. It covers everything from your doctors, your checkup, your preventative care, hospital, behavioral health, vision, dental, and everything else. Now, the key to all this for you to get the coverage by January 1st is for you to apply by December 1st. Just remember that. And I am here in the county. I am available and willing to help anyone who might have any problem or struggle, challenges, navigating through the process. But you would have to fill out a form giving me permission to do that for you, and so I can follow up for you with Tallahassee. So just let me know. Ginger has my information. She will be forwarding that to everybody. Keep in mind that you also a healthy kid is an option for you if you have children and you don't feel that whatever is being offered to you right now is what you really want or need. Healthy Kids is an option for you, and we'll be more than happy to provide you with information. Fill out your application. You could do it online. You don't need someone to help you with that. But again, if you're going through the process, you needed assistance, please do call me. I will give you some information. Apply online, submit all your documentation, pay your premium, and that you will be on the way to getting your child covered. And I will be taking question also at the end. Thank you.
Also with the kid care, for those folks who are currently in our second and third tier, not the ones that have been hired since 2003, for the most part, anyone in that category, their health insurance today is considered affordable. Anyone else that may be in that second or third tier, you may qualify today for health insurance for your dependent children based on the fact that the premium for your children may be more than 5% of your gross income. It is for a lot of people that work for us. So at the full pay option, it may be a less expensive alternative. It's not a bad idea to look into that now. If you do get coverage for your child prior to 1/1, we do allow you to do a change in status. It is a qualifying reason to receive Healthy Kids. So you would just need to contact our office and provide us with a copy of the Healthy Kids Award document, and that would allow you to drop their coverage before 1/1. So really the folks that need to wait until December would be the ones that may be in that the top tier or hired before 2003, because chances are you would be denied based on the fact that the insurance for you for now is still affordable for dependents. Okay, so we are now going to be available to answer group questions for you. We'll do that for a few minutes, and then we'll break out for any individual questions that you may have. So anybody have a question? Yes. Absolutely. And the question, I don't know if you heard, if you can have it dependent on any of our other plans if you decide not to put them on our medical coverage, absolutely. Dental, vision, anything. Up to age 30. There's some special requirements for 27 to 30-year-olds that they have to meet in order to remain on our plan. And that's just for dental and for medical, vision, and all those are up to age 25. Yes, right here. Mm-hmm. That is correct. No. No, yeah, no, that's what I said he can be on. No, that's for children. And vision, absolutely. That is right, because because your health insurance for you is considered affordable for the employee only. For employee only. Yeah.
Okay, so the state of Florida, our approach here has been more or less not to comply with the mandates about creating an exchange and expanding Medicaid, for example. So the federal government is setting up our exchange, and it is supposed to start on October 1st, and the key word there is supposed to. We don't know what it looks like. We don't know if it's going to work correctly. We have very limited information, and the Department of Health and Human Services has said that we will all see it on October 1st. But the website is going to be, or is, healthcare.gov. And you can actually go out to that website now, and there's a couple of little elementary type calculators that, they kind of have holding the spot on the website where the exchange is going to be. But come 10/1, you're supposed to be able to go out to healthcare.gov to access the exchange. And there are also navigators that are available. I know that Danny's team is going to be doing that for some St. Lucie County, at some St. Lucie County locations, so she can speak to that. But it's kind of a question mark right now on what it's going to look like 10/1. Mm-hmm. Yeah, there's nothing available. Each state is kind of different. So there are some states out there that are operating their own exchange, and they're ready to go. And there's like 25 states, including Florida, that are going to have a federally run exchange. And we're hopeful that it's going to be up and running and ready to go 10/1 like it's supposed to be. Now, I want to make sure everybody's clear that we know that we're not eligible for a subsidy, but you are still able to go out on the exchange and purchase coverage. You would just have to pay the full premium for that coverage. And the exchange is set up in a way where they have metal plans. So a bronze plan is a 60% valued plan, then you have silver, then you have gold, and then you have platinum. So it's 60, 70, 80, 90%. So you can pick all different kinds of plans from a benefit standpoint, depending on what premium you can afford. And yes. No, there's no medical underwriting allowed anymore for coverage. So when you go out to the exchange, or if you choose that you want to buy coverage outside of the exchange on an individual basis, you're going to put in information about your age and your gender, and no information at all will be required or requested about your medical history. So it's all what they're referring to as guarantee issue.
No, your deductible starts over again January 1.
The cost for prescription drugs and like that information available in that form?
The cost itself, Ginger had a really good example yesterday. When you go into like Walgreens or CVS and you get your receipt and it says your insurance saved you X, that'll give you a good idea of what the cost of that medication is going to look like. There is a cost estimator on the Blue Cross website that allows you to compare providers. So for example, if you take Nexium, you know, buying Nexium from Publix may be very different from Walgreens or Walmart. So you can look at that on the website as well.
Mm-hmm. No, it will not. Use it if you have it, absolutely. But I will tell you, there's actually, I think, a better benefit with Delta Dental. It's called a DMP waiver, which is a Diagnostic and Preventative waiver. So what that means is, today the plan that you have when you go in for cleanings, x-rays, exams, the fee or the cost, even though you're not paying anything out of pocket, is accumulating to your max for the year, the most that the plan would pay, either $1,000 or $1,500. What Delta has is they are no longer, they will not use those dollars for your preventative care towards your $1,000 or $1,500 max. So if you're actually utilizing the 4 cleanings a year that comes with the plan, that could be $500, $600 a year. That's not going to be going to your max out of pocket. So yes, the rollover is going away and you'll lose what you have. So I would suggest if you have anything that needs to be done, use it. But that waiver is definitely a nice added benefit to going to Delta. Yes? Mm-hmm. That other $1,500, or the second half of that, is actually that 10%. When you see all the services that you have done, you have deductible first and then 10%. Okay, so your $1,500 has been met, and you go to the doctor or you go to the hospital. You are then responsible for 10% of the charge until you've reached your $3,000 max out of pocket for the year. It's only 10% that you're accumulating. And then once you reach the $3,000, as long as everything remains in network, then you won't have any additional out-of-pocket expenses. That's right. Yes. Mm-hmm.
No, Medicare benefits are completely different. It is a Medicare benefit. There's benefits that are available to Medicare participants where you do get things at no cost share. That has nothing to do with Blue Cross. That's based on the Medicare plan design. So Blue Cross follows some of the fee schedule, but not the benefit schedule, because that's a Medicare benefit. So the answer on this plan would be no. If you have durable medical equipment and things of that nature, it's subject to your deductible, and then it's going to be covered at 90%.
Here's a question over here. Yes.
No, it doesn't, because you're not claiming either of you as a dependent. Correct. Yeah. Yeah. And you can have your child's expenses can be used through your HSA. It's just that maybe if there's a younger employee here that's still being claimed on their parents' tax return, they would not be allowed to have and contribute to the HSA.
Yeah.
FSA is a flexible spending account, and for St. Lucie School Board, you can have the FSA if you're on 5771, An FSA has a $2,500 max contribution for the year, and that money is available to you on January 1st. And if you don't use it, you lose it. An HSA, which we explained today, is only available on high deductible health plan participants, and it works like a checking account. So the money has to be in your account, as I explained, before you can use it. And that was my baby example. And that rolls over from year to year to year, and you can invest the funds after you meet certain thresholds. An HRA is a health reimbursement account, and that only allows employer contributions. Employees cannot contribute to that, and that is not being offered through St. Lucie County School Board. The HSA Administrator is Health Equity. So if you want the board contribution of $750, that's going to be where you're going to get your HSA account.
No, as much as you want. There's no minimum or well, there's a max, but there's no minimum requirement. Yes, it is a qualifying reason, but it has to be done within 30 days of the actual event, meaning that's when you were awarded. So you couldn't come in and say, my kids have healthy kids back in March, but if you came in with a document stating that they have coverage effective October 1st, absolutely, we could get them dropped right away. It's always the first of the month following when we take care of the paperwork. Okay. Yes? No, we have an employee plus one dependent coverage, and you'll see there's a separate rate for employee plus one dependent. It's still significant to add one dependent to your plan.
Is the cost per child you mentioned, children 1 to 5 and the children that were older, is that per child you pay that cost or not?
And that's for the full pay option. If you do qualify for the subsidy with healthy kids, which is completely different than the exchange, but if you do qualify for the subsidy, that $15 or $20 is what you pay for the month for all of the children together. It's not 15 or 20 per child. So the full pay option is the per child amount. Yes?
So the employee plus one option only covers employee plus child?
Yes, you can cover. The one dependent can be anyone. Yes. Anybody else? Yeah. If you cover your family to the plan, we're going to take $476 every check. Yes. So that's why we suggest anyone that may have children on the plan or dependents on the plan to definitely look at Healthy Kids. It's one application, and depending on what your income is, they will move you to different categories based on what your income level is. So if you qualify for Medicaid, is that right? They'll move you to the Medicaid group. If you qualify for the subsidy, you would go over to that department, but it is one application. Okay? Yeah. There's no increase in any of the other benefits that we're offering. The dental, even though we're changing companies, the rates are exactly what they are today. It's still the same high and low option. Yes, same thing for employee and family, yes. Yeah. Regarding the subsidy for your children, that'll be awarded to you based on your application for Healthy Kids. Okay? Yeah. No, at that point, once you reach 3,000, as long as you're in network, the services are covered at 100%. Everything is covered at 100%. With the exception of pharmacy, or is pharmacy included in that? And the nice thing is pharmacy's included in that as well. So once you reach 3,000, your prescription drugs, yes. So, yeah. Yes, we would deduct pre-tax, and again, that rolls over from year to year. Anybody who's ever had an FSA, if you've had too much in the account, you lose it at the end of the year. So that's available for you rolling. Yeah.
There is an option, though, if let's say that one of your family members is really generous and they want to load your HSA account for you, good luck with that, then you can make an after-tax contribution to the HSA and file it on your next federal income tax return so that you can get the tax benefit on those funds. So most traditionally you do it through payroll deductions, but you do have the after-tax contribution option if you need it. But you still have those same maximums, so it's still $3,300 and then $6,550 as the maximum amount that you can contribute between all of the funds. It would be, yes, if you're over 55, you can contribute $3,300 for a single, plus an additional $1,000 to total $4,300 per year. And each year that amount is subject to an increase from the IRS.
Question? Yeah, I mean, there's no difference in your hire date anymore regarding the health plan. So your rates aren't, there's no difference in your rates, coverage, anything like that. There is an exception. Anyone that is, the 5771 is only available to employees who are hired prior to January of this year. So anybody that's currently working for us. Anyone that's a new hire at that point would have to go into the high deductible health plan. That 5180 and 5181 are the same plan. 5180 is employee only. 5181 is when you add dependent coverage. So that's why it's listed with the two numbers together. So single coverage is 5180 and it's $7.20. And then if you add dependents, it would be 5181, and then it would either be $322 or $476 per pay. Okay. So we are actually running past time at this point. We are available. We'll make sure that all your questions are answered. But for the rest of the group, if you're set, you may leave, and then we'll be available to answer all questions. Thank you.